Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, Friday, July 24th, and we welcome any questions or comments down below or at any of our social media linked in the description. Starting today with an update on the Cyclospora outbreak. Dr. Murphy, can you bring us the latest numbers?
Yeah, well, they keep getting higher. There's now some 12,000 confirmed and suspected cases. Michigan alone accounts for over half of that, 7,171 total cases. It's a big outbreak. So Taylor Farms issued a nationwide recall of its shredded iceberg lettuce. That was on July 17th, actually, covering all retail stores, which included Whole Foods and Walmart, restaurants like Taco Bell and food service customers. Taco Bell has since stopped using the supplier altogether. Complicating the picture, the FDA announced on July 22nd that it's now investigating a second separate outbreak involving 72 patients that they have no idea what the source is. So in other words, it had nothing to do with lettuce or Taco Bell or anything like that. So it's a different little outbreak, but they're looking at that. And so it looks like the contamination is beyond the Taylor Farms supply chain.
Yeah, that's definitely not good news, but at least good that it's been identified at this point. But another big story in terms of food safety this week is that there is a massive recall linked to Salmonella. Can you tell us about it?
Yeah, so Salmonella is another foodborne infection that can be very serious, result in hospitalizations, and people even die from Salmonella infection. So Midwest Poultry Services recalled 1.6 million dozen eggs. That's over 19 million eggs produced in Texas that were contaminated with Salmonella bacteria. And they were white and brown, cage-free eggs having been sold at Kroger's in Texas and Louisiana and Brookshire grocery stores in Oklahoma, Arkansas, and Mississippi. So no illnesses have been reported to date. So it looks like they got it in time, or at least very early on anyway. And the company halted distribution from its Texas farms while redirecting eggs to a pasteurization facility and conducting an internal investigation. So Salmonella, this bacteria, can reside inside or on the surface of the eggs and typically causes like diarrhea type symptoms, cramps, fever, and vomiting within 12 to 72 hours of consumption. Keep that in mind.
Yeah, big stories in terms of food safety this week. But as we shift our focus to something that has been pervasive all year is the measles outbreaks, now a historic high this year. Can you bring us the numbers?
Yeah, 2,318 documented cases of measles in the United States, surpassing last year's total record tally for the entire year. And we're only in July. Last year's total was 2,289. This is the highest since the measles vaccine was introduced. And remember, in 2000, there were 0 cases of measles. And now we have, over 2,000 cases. No deaths this year. But if you look at some of the data a little more closely, particularly from Utah, which has a very good public health department, they had 711 cases and 8% required hospitalization, primarily in unvaccinated people.
Yes, and as we know, the best way to prevent against measles is vaccination. So make sure that you are up to date with your 2 shots to prevent the spread of measles.
Yeah, because
Looking,
it can be very serious because measles can cause encephalitis and inflammation around the brain. And actually, in South Carolina, they had 2 cases of that. We don't know what the long-term consequences are. Those patients did survive, though.
absolutely. And looking overseas at a story we've been following very closely, the Ebola outbreak, mostly stemming from the Democratic Republic of Congo. New case counts this week. Can you bring us up to date?
Yeah, the case count is now over 2,500 confirmed cases, with over 1,000 deaths. This is the third largest Ebola outbreak on record, and it's just taking off. So it's likely to become the biggest one. Um, it's this a rare version of Ebola called the Bundibugyo, and it got off to a very big start because the tests they were using didn't pick up that strain. So there was a lag in getting this thing started. So you probably have heard that asymptomatic Americans trying to come home, have been told they have to quarantine in some other country for 21 days. Now, this is a kind of interesting because asymptomatic people are generally not contagious. And you could quarantine in your own country. But anyway, that turns out to only apply to people flying into the country. So there are a group of 14 American citizens returning from Congo. These are primarily healthcare volunteers that are working in the epidemic. And they flew into Canada and tried to cross the border in Vermont and New York, a land border. And so they were stopped and they were sent to Fort Drum in upstate New York. And they were quarantined for 4 days there, and then they were finally released. So this is just the policy they're doing is actually unnecessary and silly, and it's just disturbing. Yeah, you could stay in France or UK or Kenya for 21 days, and then you can come home. It's probably illegal too, but anyway, that's all being played out now in the courts.
Yeah, very interesting story there. And of course, we will keep up to date on those case numbers and the very sad high number of deaths occurring there as well. Now, something that is also very sad is that fewer children received HIV treatment after US funding cuts in Africa. Can you tell us about this?
Yeah, this was a study presented at an ongoing AIDS conference, a global AIDS conference occurring in Rio de Janeiro right now. And roughly 77,000 fewer children are receiving US-supported HIV treatment. This is a 14% decline. The US State Department is saying, well, there's fewer pediatric infections, but there's data that shows that this is way more than just the decline that was happening. In Kenya, also disturbingly, healthcare workers are reporting that children are presenting with HIV with very advanced HIV/AIDS disease. So that's also disturbing. This is going to result, it's been estimated that somewhere between 4 and 10 million people will die because of the pullback, the way the United States pulled back the support for the AIDS treatment. AIDS treatment is like insulin and diabetes. You can't just stop it. You could have phased it out. You could have lined up another partner, but just stopping it like this is having these kind of consequences. It's really quite devastating.
Devastating and quite disastrous. But we have two more stories today, smaller outbreaks. A
Mhm.
follow up on that Legionnaire's disease outbreak in New York City. Can you tell us about it?
Yeah, the Upper East Side of New York has now 76 cases and 4 people have died. This is of Legionnaire's disease. And of the 76 cases, 53 previously hospitalized patients have been discharged and 7 remain hospitalized. And Notably, this is just 1 year after another outbreak they had in Harlem, which is further up on the east side of Manhattan, which sickened 92 people and killed 7. So Legionella is in these cooling towers, and there is a way to sort of clean those up, and it's prompting the city to pass stricter laws requiring more frequent inspections.
Mhm. And our final story today, a bit of a buzzword lately after the previous outbreak was declared over, but it seems there are more hantavirus cases unrelated to the last ones in Venezuela. Can you tell us about them?
Yeah, so hantavirus is going around is present in the world, and there's cases, every year. Even in the United States, there's approximately 50 per year. Remember, Gene Hackman's wife had it, and I mean, it's out there. So anyhow, Venezuela has confirmed 3 hantavirus deaths in one of their states, and 2 additional deaths in a neighboring state are still under investigation, but they haven't confirmed that yet. So this is the strain that is circulating is not the strain that was on that boat that came from southern Argentina. It's the one that's more like the strain in the United States that is only transmitted from rodents. It's not person-to-person strain. So the the timing is notable given that the CDC declared that the cruise ship hantavirus is officially over a month ago. That doesn't mean hantavirus has gone away, but the one from that epidemic on the boat is over.
Absolutely. So to reiterate, this is not the same outbreak, and there is no human-to-human transmission
Right.
seen. Still
Unrelated.
upsetting that still upsetting that there have been deaths, but no need to worry about a global outbreak of hantavirus from person-to-person transmission here. But on that note, I would like to thank you, Dr. Murphy, for your time and your expertise, bringing us up to date on all that is important this week in public health.
Oh, great. Thank you, Katie.
And thank you all for joining us this week. We hope to see you back next week. And as always, any questions or comments are welcome down below or at any of our social media linked in the description. As a reminder, if you'd like to see Dr. Murphy's sources straight in your inbox, you can subscribe to his Substack for free, which is also linked down below. Have a nice weekend.